Memorial Hospital. The reason we are here is that the Department of Health, the Gauteng Department of Health, gave assurances to patients on the 25th of March that the renovations to their theatre complex would be completed within a 2-month period, and that people who were supposed to be having elective and emergency surgeries would be accommodated within a 2-month period. Well, that's not the case in any way, shape or form. Patients have repeatedly been deferred. I have raised questions in the House. I have raised questions with the MEC of Health, Faith Mazibuko, about referral pathways for patients who are in pain, patients who need surgeries like Adele, who is sitting on my right, who was promised a hip replacement in March of this year. Nothing has happened. Faith Mazibuko denies that there are any delays in surgery, whether those delays are for emergency theatre or whether those delays are for elective surgery in theatre. Unfortunately, her replies to questions that I have posed are riddled with contradictions. You will find those replies in your media packs. She claims there have been no delays in any of the surgeries that have been taken place because she says that the refurbishments are being done on a rotational basis. If that is the case, please explain to me why patients come back month after month after month only to be told, sorry, no surgery now. Sorry, no surgery this month. Surgery in June or maybe November. And now we are being told June 2027. That is completely and utterly unacceptable. The DA has previously condemned the department's inability to provide proper referral pathways for patients anxiously awaiting either elective or emergency surgery. I am joined today by Katshitelo Rasalingwana, our mayoral candidate for Ekurhuleni. Katu is a fellow member of the Gauteng Provincial Legislature. She, like me, is committed to ensuring that patients in Ekurhuleni have optimal chance to get decent health care. We are so tired of MEC Mazibuko's obfuscation and lies regarding the availability of patients to receive treatment that my next step is to actually escalate this to the Premier of Gauteng, Premier Lesufi, to demand that proper referrals are available to patients. So far, we have been told that the renovations have cost 6 million rand. 6 million rand, and patients are walking in pain. That is unacceptable. A DA government would never allow patient care to suffer at the hands of renovations. We would ensure proper referral pathways and decent planning. I'm open to questions, as is Adele, and as is our mayoral candidate, Katshitelo Rasalingwana. Thank you so much. Do we have any questions? I'm going to hand over to Katu.
Thank you. Thank you so much, Medi, for the opportunity and the fight that you have been fighting for the people of Gauteng province, particularly when it has to do with everything that is related to health for our people. I want to take this opportunity to greet all the members of the media that are here, to greet the patients that have had the courage to talk to us as the Democratic Alliance. As you are all aware that the right to quality health care is enshrined in the Constitution. This is something that was hard won by those that fought for our freedom. Health care is more than just a national competency. It is one that is provincial as well. And therefore, the Gauteng Provincial Legislature may have a responsibility. But sadly so, the reality on the ground, particularly in Gauteng province, it's quite very disheartening, and that is why we are joined by patients that have been obviously subjected to the pain. And we as the Democratic Alliance really just want to say that in our own city of Ekurhuleni, this is not something we can be proud of. This is not something that we stand for, and this is not something that we will sit on the sideline and not confront those that have been entrusted with the responsibility. As a mayoral candidate for the city of Ekurhuleni, I want to work very closely with my colleague, the DA spokesperson responsible for health in Gauteng province, MEC Madeleine Hicklin, to ensure that our residents are treated with dignity, but are also afforded the respect that they so desperately need. Delays like this one we have heard about today about Tambo Memorial Hospital, where Mrs. Stolz had to wait for a life-changing hip replacement surgery, must not continue in the future. It must not continue while we sit on the sideline and watch. And that is the reason I decided to join you here, Medi, to say and confirm and assure you that you will not take this fight alone. We will be behind you, ensuring that you take the Gauteng Health Department heads on for our residents to ensure that they are able to get the medical services and procedures that is due to them. When I am a mayor on the 5th of November this year, I commit to myself to ensure that all the patients from Ekurhuleni in our district hospital and municipalities clinics are treated with dignity and respect, and that they are having access to essential services that is promised to them as per the Constitution. We need to ensure that every patient has access to appropriate and timeous health service and treatment. And I really just want to take this opportunity to say that only the Democratic Alliance, our administration, is committed to ethical, transparent, and corruption-free government. We will ensure that patients receive timely treatment. We will ensure that they are afforded the dignity and the respect that they so desperately need. This is my promise to you as resident of Ekurhuleni. This is my promise to you, together with my colleague, to all the residents of Gauteng province. Healthcare should not be dependent on who you know or how connected you are, but it should be afforded to every resident to ensure that they are getting quality care, the dignity and the respect. And I want to say to the resident of Ekurhuleni, on the 4th of November, you have the opportunity to bring real power that will serve your best interest at heart. So I want to take this opportunity as I conclude to encourage you to go out and register on the 1st and the 2nd of August next weekend. And I've been saying that I understand that we have so many plans within our diary, but I can assure you that that process will not take you so much of your time. And for us to be able to fight situations like this, it is important that we fight them in the ballot box. We fight them through ensuring that we are registered to vote and send them packing, because for the longest of time we can see that they're unable to govern and to also ensure that our healthcare system serve the residents that have entrusted them with the responsibility. With that, colleagues, I want to take this opportunity to thank you, Medi, for all the hard work that you have been doing on behalf of the residents of Gauteng province. Thank you.
Do we have any questions from the media on this particular issue? I want to assure you, the issue faced by Ms. Stolz with regards to a hip replacement surgery that has not happened is not faced by her alone. There are hundreds of patients who are in this situation, not only at Tambo Memorial Hospital, but at countless hospitals throughout Gauteng. Tambo Memorial is the one that made the promises to Ms. Stoltz, that said to her, come back next month. We will see you next month. Next month, we will make a plan. Well, next month came and went, and there was no plan. The only plan was more medication. Medication doesn't help when you have the chance to get a life-changing, life-altering hip replacement surgery. To any of you who have had operations that are as life-altering as a hip replacement surgery, you understand what it's like to live without pain. You understand what it's like to be able to walk freely, to be able to turn over in bed without having to shriek in agony, to be able to sit in a chair, walk to the shops, walk in the shops and do your monthly grocery shopping. That is an option not open to Adele. She is impacted every single solitary day of her life. She can't work properly, she can't live properly. That is an infringement of her dignity as a human being. And as the Democratic Alliance, we say enough is enough. We don't have a money problem in this country. We have a corruption problem, a maladministration problem, and a leadership deficit, not only in the Gauteng Health Department, but in the Gauteng Provincial Legislature. And with your help, let us change that. Thank you so much, everyone, for your time.
Can we get the patient to talk?
Do you want to say
Let me introduce.
No, she says she's fine.